we get a lot of patients with dental anxieties. But what's amazing is I've realized through the years, when I started practicing, there was a trend. That trend was sedation dentistry. Come in, get sedated, we'll fix everything. And I found that that did not truly deal with the patient's anxiety. If you do not communicate properly and educate, that patient will continue to remain anxious. The thing that I find that helps most the anxious patient is to sit down and listen. If you listen, really listen, the patient will tell you what's wrong. If you understand how to treat people, the dentistry becomes easy, right? The patient has to trust you with what you're doing. You know, it's not about doing the work. You could be the best clinician in the world, but if that patient doesn't have confidence in you, then there's no bond, right? So that's super important. And over the years, I shied away from the sedation dentistry. I sedate my patients, but only with the understanding that the sedation is going to make them relax. I'm not sedating them because they're anxious. I try and beat the anxiety before the sedation. Because if they're genuinely anxious, they'll never walk through that door the day of the appointment, right? So for me, it's like getting a cat out of a tree. Come down. No. Come here. And you slowly coax them down from the tree. And it's amazing. I've had so many anxious patients that I've just talked them out of the tree. And now they trust me. And it's years. And they refuse to go anywhere else because they know that if I have to slow down and stop and wait, I'll do it. Whatever it is to make them comfortable, right? But that takes communication, understanding, empathy. You have to feel. You have to understand what that patient feels. You have to understand what it is to be a patient yourself. Put yourself in that patient's spot and say, okay, it's okay to be scared, but we got this.